Hello, my name is Rhiannon and I'm a specialist dietitian at UHDB. In this video, you will see a demonstration of how to complete 2 alternative measurements that can be used to support the identification of malnutrition risk in your patients. To take these measurements, you will require a tape measure in centimetres. The first measurement is ulnar length, and this can be used to estimate a patient's height when this cannot be measured or is unknown. Knowing a patient's height will allow the estimation of a BMI to be completed. Typically, it is recommended to use the non-dominant arm unless there is a clear reason why it cannot be used. If able, ask the patient to place their bare arm across their chest. Find the point of the elbow, known as the olecranon, and the midpoint of the prominent bone of the wrist, known as the styloid process. Place your tape between these 2 points and take a measurement to the nearest 0.5 centimetres. This is the ulnar length. Using the MUST alternative measurement table, you will be able to convert this length into an estimated height based on the sex and age of the patient. Document this height as estimated using ulnar length and use it alongside the patient's weight to calculate BMI. The second measurement is mid-upper arm circumference, which is often referred to as MUAC. A MUAC is a crude measure of an estimated BMI and can be a useful way to monitor weight changes when standing weighing methods are difficult. It is not designed to generate a MUST score, therefore can be used to help support an overall impression of a patient's malnutrition risk category alongside subjective indicators. Once again, use the non-dominant arm if able. If this method is likely to be repeated in the future, it is important to document which arm has been used so that the measurement can be repeated consistently. The patient should be standing or sitting and place their bare arm at a 90-degree angle. Find the bony tip on the outer edge of the shoulder blade, known as the acromion, and the point on the elbow, the olecranon. Measure the distance between the 2 points to identify the midpoint of the arm. Mark this point on the patient. Ask the patient to now hang their arm down loosely. Pass the tape measure around the arm at the midpoint to obtain a measurement, again to the nearest 0.5 centimetres. Take care not to pull the tape too tightly. It should just fit comfortably around the arm. Use the MUST guidance to identify whether the patient is likely to be underweight or overweight based on the MUAC measurement. If the measurement is less than 23.5 centimetres, the BMI is likely to be less than 20. If the measurement is greater than 32 centimetres, the BMI is likely to be greater than 30. Changes to the MUAC over time can indicate changes to a patient's weight and is a valuable measurement in the monitoring of malnutrition risk. Further guidance and support on the completion of MUST scores can be found on the BAPN website. Follow the care assessment pathways once you have completed a MUST score.